So for my respiratory assessment, I am first going to identify the position of the lobes of the lungs. So noting that the right side has 3 lobes, right upper, right middle, right lower, and the left side of the lungs has 2 lobes due to the position of the heart. Then I'm going to move on to inspection. First noting if there are any scars, masses, lesions that I need to make note of. Then I am going to move on to, let's first test the AP diameter. So I think I'm gonna test on myself because it might not work. Well, yeah, it can. I'm not gonna be able to hold it. So for AP diameter, I am noting that anteriorly, it's 2 times as big as what the width of my chest is. So our AP diameter should be 2 to 1. And then same posteriorly, 2 to 1. I'm also noting the retraction of the intercostal spaces. I'm noting if posteriorly the spine, the position of the spine. Anteriorly, I'm also noting if there's any use of any accessory muscles upon respiration. I'm noting if there's any nostril flaring or facial distress upon respiration. Those are all things that I want to make note of that might be indicative of labored breathing or anything of that sort. Then I'm going to move on to palpation. First going to palpate the chest area for any lumps, tenderness, masses. Then I am going to move on to tactile fremitus. So I'm going to go to the back of the patient and I am going to use, gosh, this is going to be difficult. This part of my hand to have the patient say Blue Moon or 99, and I am feeling for the vibration, and I'm just going to go down the center. The reason why we go down the center is because we can't hear anything over the bones or muscles. So we want to make sure we're going right here through the middle, and then it kind of fans out at the bottom. Same thing anteriorly. We're going right through here and then out. So for tactile fremitus, like I said, I am going down here and I'm telling my patient every time I move my hands, please say this word. And I am feeling for that vibration, which is indicative of no fluid in the lungs. Then I'm going to posteriorly at the hips of my patient, I'm going to put my hands here and I'm going to have them take a full inhalation and a full exhalation, and I am feeling their